I'm gonna start. I'm gonna start recording the session.
Okay, okay.
Let's see. Session. This one. All right, so I'm just gonna give another few minutes to see who else shows up. Shaquana, is that you, one of our graduates?
Yes, hi, Professor Joy.
It's great to see you.
Likewise.
I can't remember, what year did you graduate?
2018.
Very good. So is it displaying correctly to you guys? Do you see the PowerPoint?
Yes, I do.
Okay, good.
Yes.
Alicia, you just tell me when you want me to start.
Go right ahead if you're ready.
Okay,
Okay,
All
I'm gonna mute.
and is the picture of you guys in the way? Can you see that on your screen, or is it not in the way?
No, it's okay.
Okay. All right, so we're here today. We're going to talk about our graduate nursing programs. Oop, there it goes. So we're going to go over our department, the basics of all of our programs. We'll talk about the curriculum, information about admissions, some information about financial aid, and the contact information for the different programs. So in our department, we offer, in the graduate level, we offer the Master of Science in Nursing for either family nurse practitioner certification or psychiatric mental health nurse practitioner certification. So we do offer also postgraduate certificates. So people who already have a master's degree in nursing or a doctorate degree, actually, they can come back and earn a postgraduate certificate in psychiatric mental health nurse practitioner. It's very popular for our family nurse practitioners. They oftentimes come back for that certification. And we also have a postgraduate certificate in musculoskeletal health, orthopedics, and sports medicine. From this point on, we'll just call it ortho. So that certificate program is actually open to current students who have completed the health assessment course, Nursing 507. So you can actually earn that additional certification while you're a student, family nurse practitioner student, or you can finish the program, come back and complete the orthopedic certificate. It's a 9-credit program. So it's a nice addition in it. If you add that certificate onto your program of study, it is counted, and it actually will make you full-time financial aid eligible. The other program that we have is the Doctor of Nursing Practice program. We offer both post-bachelor's entry as well as post-master's entry. So in other words, you can come get your family nurse practitioner or psychiatric mental health nurse practitioner certification as a post-master's Doctor of Nursing Practice program student and skip over the master's. We'll give you some more details on the next slide, but it's a 12-semester program, and you would have your terminal degree. I think that's the smartest way to do it at this point in the landscape of nursing and the profession of nursing. But if you choose to do the master's degree and you want to come back for the postmaster's DNP, you can do that as well. Some basics of our program: the master's program is a 52-credit program, and it's completed over 8 consecutive semesters. It is a part-time program. You'll complete 2 classes per semester, and we do admit students in the fall and the spring for that program. Our certificate programs, the postmaster's or postgraduate psych mental health nurse practitioner certificate program, the credits is determined by what prerequisites you have completed. So for some of our students, it only takes them 2 semesters, and some of them it can take up to 6 semesters. The ortho program, again, it's a 9-credit program. It's 3 consecutive classes over 3 semesters, fall, spring, summer. Again, you can add this to a family nurse practitioner program of study. It does only start once a year in the fall because those classes are sequenced. And then the DNP program. So post-bachelor's entry, 76 credits, 12 consecutive semesters. And we did receive approval this week that we can start admitting in the fall semester. So traditionally in the past, we were only admitting once a year in the spring, but now it's fall and spring. And then the postmaster's DNP is a 45 credit program, approximately 9 consecutive semesters, and again, fall or spring admission. So a little bit about each program. The family nurse practitioner program is a hybrid program. You will take the 3 Ps, advanced patho, advanced pharm, and advanced physical assessment courses, and you'll take the common core courses. So in ethics, leadership theory, statistics, research, mental health, and community. In the women's health class, you complete 90 hours of clinical. In the pediatric primary care course, you'll complete 150 hours of clinical. In the adult and geriatric course, you'll complete 175 hours of clinical. And then the final advanced clinical practicum, you'll complete 175 hours. Our family nurse practitioner program is training the outpatient primary care nurse practitioner. This is not an acute care program. So all of your clinicals will be in an outpatient setting. So there are programs that are acute care. So if that's what you're looking for, there are other schools who offer the acute care. So family nurse practitioners are generally not hired for hospitalist positions. So keep that in mind to make sure it aligns with your goals. During the advanced clinical practicum course in that 175 hours, you can take 75 of those hours and do a specialty: cardiology, gastroenterology, neurology, endocrinology, orthopedics. You can do different specialty. You can pick one specialty to get that additional experience, and then the remaining 100 hours would be in a family practice setting. The psychiatric mental health nurse practitioner program, again, it's a hybrid program, the same 3 Ps, patho, pharm, physical assessment, the core courses, ethics, leadership theory, statistics, research, mental health, and community. And then the psych nurse practitioner specific courses, neuropsychopharmacology, and then 3 clinical courses that are sequenced one right after the other with 180 hours of clinical in each of those courses for a total of 540. Unlike the FNP, we don't prescribe what population you work with or the setting during the psych clinical courses. So in one of those courses, you get to choose, and it's kind of based on what's available, but you could do an inpatient setting, you could do an outpatient setting, you can do private practice or public clinic, you could do I can't think what I'm saying. You could do different settings. So it's not specific to the course. You're also, across those 3 clinical courses, you're going to get a variety of populations. So we want you to get a minimum of 60 hours in pediatric or child and adolescent. And we want you to get a minimum of 60 hours in the geriatric population. Now, if you get more, that's great. But we want to make sure you get at least a little bit of exposure with child and adolescent population and a little bit of exposure with the geriatric population. The other piece is, across those 3 clinical courses, we want you to get a variety of clinical experiences. So the role of the psych nurse practitioner is very broad. And so we want you to do things like psychotherapy and medication management, but then also other modalities of care like ECT, TMS, ketamine, Suboxone, other MAT. So, our students tend to have a real variety of experiences because there's just so many different things that the psych nurse practitioner can do. Now, the psych nurse practitioner is, and we encourage you to have clinical experiences, inpatient and outpatient, and across the care continuum, whereas our family nurse practitioner program is really specific to outpatient primary care. So during Nursing 507, we have a really fun standardized patient lab where you get to practice your physical assessment skills on real people. They're actors, and most of the time they're students or faculty or staff here on campus. But it's a really fun experience that students really enjoy, getting to practice their skills in a safe learning environment. The postgraduate certificate program for psychiatric mental health nurse practitioner, again, it's a hybrid program. If you haven't previously taken the 3 Ps, we have you take those. If you haven't previously taken an assessment and diagnosis of mental health course, we have you take that. And then the standard psych courses, neuropsychopharmacology, and then the 3 consecutive clinical courses for a total of 540 hours. The ortho postgraduate certificate program, these are sequence courses, musculoskeletal health 1, 2, and 3, and they run fall, spring, and summer. So those are taken sequentially, one right after the other. The musculoskeletal health 3 course, so generally this program is an online program, except for during the musculoskeletal health 3 program, there is a 2-day on-campus intensive program where they get to practice their skills with casting and manipulation. And I don't really like bones, so it's not really my thing, but that kind of practice and skills that they get to do. They have speakers and experts come in and help with those skills. But otherwise, it is considered an online program. They're getting ready to actually come to campus, I think at the end of May, for musculoskeletal health 3 course, which is running this summer. And so they're getting excited about this on-campus intensive. They have students from all over. They have students from, I think there's one from Chicago, one from Dallas, one from New Jersey, one from Connecticut, and there's a couple others, I think Connecticut based, but there's students from all over. And then the DNP program. So again, a post-bachelor's entrance, a post-master's entrance, you can come in either way. I did it the old-fashioned way. I did a master's in, I did a bachelor's in nursing and then a master's in nursing, and then I did my post-master's DNP. But either way, it's the same requirements. You're going to take core DNP courses. You're required to have 1,000 hours. So your clinical hours as a nurse practitioner count towards that 1,000. So our family nurse practitioner program, students complete 590 hours, which means they have just over 410 left. No, 410. And then our psych nurse practitioner students complete 540 hours, so they have 460 hours left. So you'll use those leftover hours, those remaining hours, toward your scholarly project and other activities to help meet the essentials. So our post-bachelor DNP students select either family or psych as a track, where it is optional for the postmasters. All students in both programs complete a scholarly project. And again, it's the programs are hybrid. So preceptors, we get a lot of questions about preceptors. So we can't survive, we can't have clinical programs without preceptors. So for the family nurse practitioner program, the preceptor can be an APRN. Remember, there's 4 types of APRNs. So there's midwives, there's nurse practitioners, there's clinical nurse specialists, and there's CRNA, certified registered nurse anesthetist. Now, none of you are going to have a preceptor who's a CRNA because we are not a CRNA program, but certainly a midwife, a CNS, or an NP can be a preceptor for you. PAs can also be preceptors, as well as MDs or DOs. For our psychiatric mental health program, your preceptor must be an APRN or a psychiatrist. So they must be board certified as a psychiatric mental health clinical nurse specialist, or a psychiatric mental health nurse practitioner, or a psychiatrist. It's very specific. This is the rules of our accrediting bodies. This is not our rules. But what happens is you find a preceptor, or we help you find a preceptor, and then the university and the organization where the preceptor work enter into what's called an affiliation agreement. The preceptor is sent a letter of agreement to precept the student, and then you meet with your preceptor to kind of figure out your schedule. And then after the clinical experience is over and that everybody has signed off on the hours and all the paperwork is done, then the preceptor is sent a thank you letter as well as documentation of their precepted hours that they can actually use towards their own recertification for their, we have to recertify every 5 years. And so it can be applied towards their own recertification. We use Blackboard as our learning management system for our courses, and it allows us to, have classes remotely. It allows us to record classes. Students submit their assignments there. That's where all the learning materials or class content is housed. And I was just working on this slide actually before we started because we're shifting things a bit. So from starting with your group or anybody who's starting in the fall semester, your class is going to be either on a Tuesday or Thursday. And if you elect, you can actually have both courses on one day per week. So I think for the fall, I think it might fall on Tuesdays for you. But both classes would be offered on the same day of the week so that you could actually come to campus once a week and get both classes done. Currently, that's what we do for our DMP students, but now we're starting to do that also for our master students. The students tell us they like knowing what day of the week their classes are going to be on. They can plan their schedules at work, and it is easier for them to only have to come to campus one day a week. And so we've started making that switch. Classes, so if you have classes on one day a week, that means the class might be during the day, like 1 to 3:30, or it might be 4 to 6:30. Very rarely, but once in a while, we have to schedule a class from 6:45 to 9:15. And sometimes we schedule them earlier in the day, like 9 to 11:30. So there is a little bit of variety in that. I might be able to look and see. I can't remember what the class schedule is set up for the fall yet, but that's that. And then the ortho classes are online, and the ortho classes meet remotely all the time, except for the 2-day on campus intensive. And Dr. Myrick will ask everybody who's in the group, what day of the week works for you, what time of the day works for you, and kind of puts it together that way. So they've had classes as early as like 6:30 in the morning, and they've had some later in the day at like 8 p.m., depending on the group and what works for the group. So there's flexibility there. So for admission, you're going to complete an online application. We are looking for a GPA of 3.0 for bachelor's degree. For those entering with a bachelor's degree, and those with a master's degree, we're looking for a 3.2 GPA. You're going to need letters of recommendation. We do recommend that they come from a supervisor, an employer, a faculty member, maybe somebody who can speak to your work ethic and your scholastic aptitude. We like to see comments about leadership. That's another great thing to add into those letter of recommendations. So as part of the application, you'll complete an essay. You'll also submit a copy of your license and official copies of your transcript. If you're a USJ alum, your transcript will be, I don't want to say automatically submitted, but we pull it for you. And then once your application is complete, Alicia will put it all together in a nice little package for me. I will download it. I will review your application. I will send you an email to invite you to campus for an interview. We do a 3-part interview. So part of it is kind of like speed dating. So you spend just a few minutes with a bunch of different faculty members and you go from table to table. So we have individual interview questions, and then we have a group interview activity. And then we also have you do a writing sample. And then financial aid. So financial aid is available for students that are enrolled in a minimum of 6 credits. That's considered part-time. Once you're enrolled in 9 credits, that's considered full-time. So again, if you're a family nurse practitioner candidate and you add in the ortho, that will put you up to 9 credits a semester. That's full-time. So you'll actually get a little bit more financial aid. And what you're going to do is complete the FAFSA using the school code for USJ. We do offer GA positions, graduate assistantship positions. After you've completed Nursing 507, it's the Advanced Physical Assessment course. And then if you have any VA benefits that you want to apply, we do have a person in our registrar office who can help you with application of your VA benefits. So I'm the contact information for our programs in general, specifically for the orthopedic program, Dr. Karen Myrick. And her email is there if anybody wants to take a screenshot of that. And then Dr. Theodora Sirota is our psychiatric mental health nurse practitioner track coordinator. So she's a psychiatric mental health clinical nurse specialist. I am not. I'm a family nurse practitioner. I'm also certified in hospice and palliative care. And I've been here at the university for 9 years now. So as a full-time employee, and I actually was an adjunct faculty even before that. So I've been here a long time, 15 years, I think. All right. So at this point, I'm happy to answer any questions that you may have. Am I still sharing?
Yes, you are. I'm sorry, I have a couple of chats that came in. You might not have been able to see them.
All right, I see them now.
Okay,
All right. So what do we need to apply for certificate, APRN or RN? Okay, so Monica, can you just give me a little more context?
I was wondering if you needed to have an RN or an APRN for the primary mental health nurse practitioner certificate program.
You just have to have a master's in nursing. So you can have a master's in nursing, such as nursing education from University of Hartford, for example.
Mhm.
And as long as you're an RN
Which I am, yes.
and you have a master's in nursing,
Yes, I do.
right? So you can apply to the certificate program. So what I'll do is when I look at your transcript, I'm looking for the 3P. So did you take advanced pathophysiology, advanced pharmacology, and advanced physical assessment for nurse practitioner students?
No, I did not take the 3Ps.
Right. So we'll have you take those. And then I assume you didn't take a mental assessment and diagnosis course of mental health.
No, I didn't take that.
Right. So we'll have you take, so you're looking at, I think, 28 credits.
Okay, wonderful. And after you take a certificate, can you transfer over to the DMP program?
Yes. Yep. You would just, it would be a postmaster's DNP.
Wonderful, thank you.
And then Carlene asked options for post-completion of adult geriatric acute care nurse practitioner wishing to go back for FNP DNP. Okay, so Carlene, so if you are currently completing an adult geriatric acute care nurse practitioner program, yes, you can come in as a postmaster's DNP student and you can add the FNP track. So like we know that, or I assume that in your acute care track, you have taken advanced pathophysiology, advanced pharmacology, and advanced physical assessment. So we would not have you repeat those courses. So we would have you take the assessment and diagnosis of mental health conditions, as well as, because we require that for all of our students, not just the psych students actually. And then we would have you take the family nurse practitioner clinical courses, the women's health, the pediatrics, the adult geriatric, because it's all outpatient, and then the final clinical practicum, and then the DNP core courses. That's a good question. Okay, and then Rushy asked, if you elect to do both classes on one day, would that equal about 4 hours of class time on that day? Each class is 2.5 hours. So I would say, I would more guess closer to 5 hours. There's going to be about a half an hour gap between the classes. So I would say 5.5 to 6 hours if you want to just give yourself a little wiggle room. And so if you are a family nurse practitioner graduate of our program, you have 4 classes to take. So you can only take one clinical course at a time. So it's going to take you at least 3 semesters. It kind of depends on what you want to take. You can take up to 2 classes at a time, or many of our, I will tell you that many of our psychiatric mental health nurse practitioner students usually take 1 class at a time because they're still working full-time as family nurse practitioners or adult nurse practitioners. And it's really hard to do 2 classes at a time while you're working full-time. So somebody asked about, in the completion of the postmaster's psych, does this give you a certification to perform therapy and counseling aside from diagnosing and prescribing? Yes, Sarah, yes, that is correct. You are credentialed to do psychotherapy. You're also credentialed to do medication management and anything else you're trained in during your program. So some students will get training in TMS or ketamine or Suboxone or other MAT. Whatever you are trained in and a preceptor has signed you off on, you are okay to perform that skill set. That's a great question. Having completed courses does not decrease, oh, hold on, I missed the message. Does not decrease the length of time to complete though, just fewer credits. Yeah, Carlene, it probably would decrease maybe by a semester or two, depending on how many courses you already have completed. And then, oh, I missed another one. Having completed courses, got that one. Monica, can you apply for financial aid with certificate program? If you are, so yes. So if you are taking 6 credits a semester, which you could conceivably do with the psych certificate, then yes, you can apply for financial aid. Kevin asks, I'll be coming from Mass. If I'm awarded a seat in your program, do I do my coursework? Yes. So Kevin, you can do your clinicals wherever you are licensed. So if you're licensed in Mass, you can do them there. If you elect to get a Connecticut license, you can also do Connecticut clinical in Connecticut, totally up to you. We do have, are you looking at psych? Yeah. We do have a number of preceptors and students and alum in Western Mass in the Springfield area. And yeah, and so yes, we have one at least one every semester who's up there doing clinical. So that's definitely an option.
That's very helpful to know. Thank you so much.
Yeah. All right, I think I got all the questions. I don't know. Anybody else?
When would all the paperwork need to be in? What are you looking to have it in for to start in the fall semester? All of our transcripts and all those things to you by?
The sooner the better. I mean, honestly, we do rolling admissions. So we consider every application as soon as it comes in. Right now we're doing the group and we're doing the interviews and the writing sample that everyone comes to camp. You come to campus for that. It's a 3-hour interview. And so we're doing one of those sessions every month and we'll just keep doing them until we don't have any more candidates. But we do admit on a rolling basis. So once our seats are full, we will stop admitting. So, we encourage people to get their stuff in as soon as possible.
How big are your class sizes?
It will vary. And it kind of depends on, how many students are enrolled and what the class is. So a core course like advanced pathophysiology is probably going to have 20 students in it. But for example, nursing 502 that's running this summer, they have like 8 students in the class because it was a really small group that got admitted during that semester because of COVID or whatever, Yeah. So it kind of depends on how many are admitted in that group and then how many, if it's a core course or a track specific course. So Carlene, the DNP FNP is a fall start or spring start. And yes, if you're planning on applying to the DNP, I would just apply to the DNP. You don't need to enroll as a master's student and then transfer over. So, how much time do I have? So it's only 5:29. Philosophically, and so our nursing organization who tells us about what our curriculum should include, the American Association of Colleges of Nursing, AACN, they have called for the DNP degree for all entry-level nurse practitioners by 2025. So we are starting to make that transition. So all of our students who are coming in for a nurse practitioner program are going to be on the exact same plan of study, whether you are pursuing a master's degree or whether you're pursuing a DNP degree. It's going to be the same classes for the first 8 semesters. If you want the master's degree, you leave after the 8th semester. If you want the DNP degree, you finish the remaining 4 semesters for the DNP degree. But all of your classes are going to be the same. We feel very strongly that the nurse practitioner needs to be educated with a doctoral level statistics course, research course, theory course, leadership course, public health course, and I'm missing one more, ethics course. We feel so strongly that they need to be educated at the 700 level that we are putting that into the master's degree program. What that will do is that will give you doctoral level courses credit towards the DNP degree. Whether you choose to use it or not is up to you, but we're going to give you 6 classes, 18 credits towards the DNP degree, should you decide within 3 years of graduating with your master's that you want to come back and finish the DNP.
So can I ask if I enrolled in the nurse practitioner program and say I'm in say I have 2 semesters left and I'm like, you know what, why don't I just go ahead and do my DNP? Do I have to stop and complete that, or can you make the transition and roll into that?
You can make the transition and enroll.
Okay, okay.
The advantage of kind of making the decision at the beginning
Mhm.
or making that decision earlier, the advantage is you can accumulate DNP hours, because remember, you need 1,000 for the DNP.
Right.
So the earlier you declare that you want to be a DNP major, the earlier you can start accumulating DNP hours. The nurse practitioner hours will transfer no matter what program you're in. But you can't accumulate and work on DNP hours unless you're a declared DNP student.
Gotcha. So then that would mean that I would complete my 590 or whichever hours left. And then when I go into my doctorate program, that I would have to do the 1,000 hours for the doctorate program. Or,
Well, minus the 590.
oh, you would minus that still. Okay, okay.
Yeah.
But so that, I'm sorry, so if you declared it early, what are the credits that would go towards it that you would be missing if you didn't? You know what I mean? Like, so I guess what I'm asking is like, so if there's like the 590 that you need to do for the APRN, and then the 410 that's left for the DNP, I'm just not understanding the declaration part. Like, are there credits that are going to be, because you're in the APRN program, are going to be solely for that, but if you were enrolled in the DNP program, it would go towards that?
So every semester, you're going to take one nurse practitioner course with one DNP course.
Oh, okay, gotcha, makes sense. Okay.
And so your nurse practitioner hours will count towards that 1,000.
Okay, gotcha.
The remainder, that 410 or 460, you can't accumulate those hours unless you're a declared DNP student.
Gotcha. I gotcha. Thank you.
Yeah, no problem. We're trying to, we believe that the nurse practitioner of today really needs to be prepared at the doctoral level.
Okay.
But state licensing doesn't require it. And so that's why we still offer a master's degree, but that's why we're giving you the DNP credit, because we want you to be educated at that higher level. Carlene, I'm a board certified, adult gero, acute care nurse, but I cannot work in the ER without the PEDS portion and need to go back for the FNP. I reviewed your curriculum for the combined and thought looked interesting. However, I was told it was only a spring start. So Carlene, it literally changed this week. We just got permission this week that you can start the DNP in the fall semester. When I would complete the program any sooner, I would just have a fewer credits. It would affect my financial aid. So what Carlene, I'm happy to meet with you offline and kind of hammer it out and give you a better idea of what that would look like for you. Okay, yeah, no problem. All right. Go ahead.
So are the students enrolled solely in charge of establishing arranging their preceptorships, or is the school involved with that? What is the dynamic or balance like, if there is? Could you sort of paint me a picture?
Yeah, sure. And that's a question we get a lot. So it's good that you asked. So we encourage you to use your professional network, because you can talk to people that you know to say, you know what, I'm looking, to do clinical, and I really want to be able to do clinical on Thursdays and Fridays. Do you think that's something we could work out? And use your professional network now, because it's easier sometimes to, so it's not typically in my job description that I set up clinical placements, but a couple of summers ago, it was last summer, I was calling to get placements for students. And I would call a place and they would say no. And then a student would come along and go, oh yeah, I know so-and-so who works there, and they're going to let me do clinical there. So the professional networking works better than cold phone calls from the university. And so we always tell students, use your professional network first. If you're unable to find a preceptor, we have a person who, that's her job. She works with dealing with all of our clinical experiences for all of our graduate students. So you're going to contact Trisha and you're going to say, I need help finding a preceptor. She's going to have you fill out a form that kind of explains what you're looking for, where do you live, how far are you willing to drive, what days of the week are you looking for? And then she will try to pair you with a preceptor that we've used recently. And what happens when we do that, sometimes students say, oh no, it's too far, I don't want to go. And we're kind of like, well, it's really challenging. So, but we'll hopefully help find a preceptor for you. We tell students, do not make cold phone calls. They don't work. They're very ineffective, and it really angers the clinical agencies. And then they call us saying, your students are calling us, and we told you we don't have any sites. So don't make cold phone calls, but use your professional network. And if all else fails, contact Trisha, and then she will help find placement. And I have to say, knock on wood, it's been hard, but we've always been able to place 100% of our students every semester. Not always like quickly, or not always immediately, but within reason, we've always been able to place our students 100% of the time. It has not held up anybody's graduation because we couldn't get placement.
I have a question that kind of falls in line with that. Is there a length of time that the person that you're precepting with, that they need to be acting in their role as a psychiatrist or an APRN?
Yep, they must be practicing in that role for at least 1 year before they can be a preceptor.
Okay.
So not necessarily the time they got licensed, but the time that they started practicing in that role. Yeah,
Okay.
That's a good question. I'm glad you asked that one. Yeah, go ahead, Kevin.
The rules are sort of the rules, but I'm just throwing something out there real quick. If I hear no, I hear no. I have a professional network in an emergency department where I live, and being interested in the Psych NP program, I know that the physicians that I've worked with, and I think one of them would be able to precept me, have experience prescribing psych meds and some experience with that modality. Or does it have, or do I have to absolutely be working with a psych APRN, PMHNP, or psychiatrist?
Yeah,
I'm wondering about that.
Yeah, for the psych, it has to be a psych CNS, a psych NP, or a psychiatrist.
Got it.
Yeah, I mean, we've had students like, there's DOs who are addiction medicine, right?
Yes.
And unfortunately, AACN says, no, they cannot be a preceptor for a psych program.
Okay.
Yeah, I know.
Thank you.
Yeah, no problem. Just like social workers, right? Social workers would be great to work with because they do a lot of therapy and counseling, and we can't use them. We can't use them. Great. Any other questions? Jean, did you have a question? Oh, okay. Yeah. Carlene said the school she used for her adult gero acute care didn't allow PAs, but they could use DOs. Yeah. So for family nurse practitioner, we do allow PAs, clinical nurse specialists, nurse practitioners, MDs, DOs, midwives. That's another one. Women's health nurse practitioners. Yeah. All right. So great. I'm, happy to talk offline with anybody who feels they need a little more information, or, don't want to get very personal here online. That's no problem. Just reach out. So my contact is, I'll put it in the chat. Alicia is very well versed in our programs, so feel free also to ask her. She can answer a lot of questions, and if she can't, she'll reach out to me. And that's it. That's about it. Anybody else have any final questions or comments or anything? The essay for the application, Sarah, or? Yeah, there is a prompt, and I think it's give us an example of a practice problems that you've identified in practice, and also where do you see yourself, or what will this degree or certificate do for you, like in 5 years from now? Kind of where do you see yourself in 5 years? Yeah, there you go. All right. Well, thanks everybody for coming today, and reach out with any questions. Kevin, go ahead.
How many letters of recommendation are needed in the application?
I think it's 2.
It's just
Alicia,
two.
is that right?
And those are 2 professional references you want, correct?
Yes. Yeah. It is better if it comes from a supervisor or faculty, somebody who can, either speak to your scholastic aptitude, your work ethic, and leadership.
Okay.
All right.
Could I interject with one thing about the application?
Yes.
The letters of recommendation can be uploaded by each recommender. So as soon as you enter, while you're completing the application, you have 2 forms to fill out that are included in the app. And we ask you to select the email option and just enter the professional email address for the recommenders. We'll automatically send an email that contains the link that they can upload the letter right to. So basically all you have to do is let them know that you're planning on applying to this program and to expect an email from the admissions unit at USJ.
I might have one more question, I think. So I did start doing the upload for the letters of recommendation and like my license and a few other things. So I have to fill out paper and submit it to the schools. This is where I initially got my RN license and where I obtained my BSN. You want both transcripts from both schools? Is that correct?
Yes, please. They
Okay.
have to be official. So order them either through the school to come to us electronically. It can go to graduate@usj.edu.
Okay.
Or you can use Parchment. It's a global national setting where you just go down, select the school, and then tell them where you want the transcripts to be sent.
You said that's on Parchment? I'm sorry.
Yes, Parchment, www.parchment.com.
Thank you.
Mhm.
Okay, I think that's it.
Alicia, did you want to share what the prompt was?
I can share that via email. I
Okay.
don't have it off the top of my head,
Okay.
but I can share it off of email, and I'll send it to all of you.
And Sarah asked if her transcripts will, her undergrad and grad transfer over.
Yes, she's a USJ graduate, so we can download those and put it to the new application. Just, obviously make sure you enter that as an institution of attendance. We would not know, operators in our ops team would not know. So it would kind of hang in limbo. So please make sure if you've done any coursework at USJ, add that as an institution of attendance on the application. I also put my email in the chat box if you saw it, for those of you who have not connected with me already. So feel free to, it's my first initial and last name, no hyphen, ablueglass@usj.edu.
All right. Thanks, everybody.
Thank you.
All right, thank
so
you.
much.
Have a good night.
Okay, you too.